Hello, everyone. My name is Zahar, and I'm a second year medical student at the University of Saskatchewan. And today, for the CAR RFS MSN, we are interviewing an abdominal imaging fellow from the University of Ottawa, Dr. Shen. Without further ado, I would like to hand it over to Dr. Shen to introduce herself.
Hi, I'm Dr. Shen. I'm currently a abdominal imaging fellow at the University of Ottawa, and I started in July this year, and I'll be here for a year. I'm originally from New Zealand, so yeah, this is a great experience for me, and so far I'm really enjoying my fellowship. And thanks for letting me be a part of your program.
We are very excited to have you, Dr. Shen. Can we please start out by hearing about a little bit about your path to abdominal imaging in general?
Yeah, so basically it was quite a long process from medical school to fully trained radiologist in New Zealand. It takes 6 years of medical school, minimum of 2 years of working as a general intern before you can apply for radiology. So, and then radiology training is 5 years. So I finished my training in 2020, worked a year in New Zealand as a staff radiologist at a very small general hospital, and embarked on my journey to Ottawa in June during the pandemic. And yeah, and the reason for Ottawa is because one of my senior trainee, he was like in his fourth year and I was in my first year, and he was just this really aspiring, amazing radiologist, like the golden trainee at the training center. He was coming here 4 years ago. So at the end of my training, I kind of emailed him and asked him about this fellowship, and he strongly recommends this. And here I am. Yep. And he was doing abdo, and I always thought I was always interested in abdo because it's just such a huge part of radiology of the human body, and so much of emergency radiology trauma, as well as oncology, is all kind of abdominal imaging. And I just thought it's one of the most useful things to do a fellowship in for the future.
Very interesting. It's a very different path from a lot of us and what a lot of us in Canada do to get where you are. But to something that we all perhaps have in common, what initiated your interest in radiology in the first place?
Yeah, so I didn't decide on radiology for quite some time. So I always kind of had a tendency towards plastics or ENT surgery when I was a medical student. And I worked a lot of surgical rotations as a junior doctor. And then I actually took 6 months out and did a kind of trip around the world, backpacked, and thought about life and stuff, and decided actually I don't want to be a surgeon. I don't want to spend 8 hours in OR when I'm 50. And I've always liked radiology. Like I actually went to Vancouver and did some radiology elective in my 6th year of medical school, and always enjoyed the teaching, the MDMs. So it's really relevant. I'm quite a visual person, so like just being able to see things and to problem solve and detect little puzzling pieces and help other doctors with the diagnosis was really interesting to me. And I think overall, radiology seemed to be the right thing to do. And also, a lot of my friends from the same year of medical school end up doing radiology. So it was kind of really popular in those 2 years when I kind of, thought about it. And they all love the lifestyle. They all enjoy everyday work. So that's all, like, those are all big points for choosing radiology. Yeah, and I think I got to a point I'm like, if I don't do radiology, if I can't get through radiology, I'm just going to quit medicine altogether and not be a doctor altogether because I don't want to do anything else.
Well, we are glad that you stayed in medicine and became a radiologist.
Yeah, thank you.
Because I hear about people wavering between surgery and radiology quite a bit. Was there any particular reason why you chose radiology over surgery?
For me, probably mostly the stress of being a surgeon, you know, the long hours. Like I did a kind of, we have non-training resident run. So I did 6 months of cardiothoracic surgery. I just hated it. Like every day you were in theater, some evenings don't finish until 9, 10 o'clock. You know, you basically have to be there until surgery finishes, and then you round after theater, you round before theater, and your patients are so sick, and it was just like, I don't see myself going through that for, you know, another 5 years. And yeah, and another big thing for me is I know that in Canada, teleradiology isn't a big thing yet, or maybe not going to be forever. But in Australia and New Zealand, telerad is huge. A lot of the smaller hospitals kind of outsource their overnight scans to be reported by radiologists that's situated outside of the country. So that's the potential of traveling or working wherever you are, really kind of drew me to radiology. So a lot of technology is helping the radiologists to kind of live whatever lifestyle they want. Like one radiologist I know, she has a workstation on her yacht. So she basically can, you know, as long as there's internet, she could work. Yeah.
Well, you're for one selling me very much on radiology.
Yeah.
We already touched on this a little bit earlier, but why abdominal imaging?
Yeah, like I said before, I think it's just so important. And another thing I like it is sometimes it's really clinically relevant. You often get really cool like pathological correlation. Like if you have a good relationship with a surgeon, you call something on your CT, and a few days later you might be able to see pathology, or you know, like, or you get to read their surgical notes and see if you're right. And it's like, as long as you have some feedback, you can always improve as well. um, and in terms of diagnosis, I find sometimes maybe we can be a little bit more definitive and less sitting on the fence. I don't know, maybe it's a personality thing as well. Like I like to be helpful as I can be, and not be unable to exclude everything, you know, like that's just not, yeah. Yeah, so I feel like, you know, if you know your stuff well, hopefully you can be as helpful as possible. And yeah, and I think it's a clinical side, you know, you are a doctor after all, you're not just reading images and giving a list of differential that doesn't apply to the patient. For me, it's important to look up the clinical part of the patient, take that into consideration, and give a reasonable differential that's actually going to be helpful. So I think Abdo kind of, yeah, there's a lot more clues than some other imaging, maybe. I don't know. Yeah, it yeah, just like it.
Very interesting. And working as so far an abdominal imaging fellow and in the future as an abdominal imaging radiologist, what would be your bread and butter type of work, both in terms of imaging and in terms of procedures?
So imaging, CT, I suppose CT is like the workhorse in radiology department. Yeah, so CT, and then that kind of goes into, you know, your outpatient oncology, which is a huge part of our work. Outpatient like diagnostics, you know, non-specific abdominal pains and those kind of things. The actual working up of pathology is part of it. And I suppose depends on where you work. Like, yeah, that's probably CT, a lot of CTs. Um, if in terms of procedure, we actually do a lot of thyroids here. So for some reason, thyroid biopsies are part of Abdominal Radiologist job in Ottawa. And like today, I did kind of 18 nodules on lots of patients. And yeah, you're just doing lots of FNAs for thyroids. And yeah, so lots of ultrasound guided procedures. Yeah.
18 is quite a few. Is that typical?
I was covering 2 rooms today, which is good because yeah, like you kind of just smash it and leave early. So yeah, usually it's divide and conquer. Like usually the staff will take one room, I'll take one room, but yeah, but I don't mind because you know the staff can concentrate on reporting and they're way more efficient at reporting, and we do lots of reporting as well. But you know, it's one of those days that you get your hand-eye coordination and practice your skills, and you know, obviously the more you do, the more likely you are better at it. So yeah.
And more generally, what does a usual day in your life look like?
Depends on what modality I'm on. So in Ottawa, we have days we do ultrasound guided procedures. We have days that we're doing CT inpatients. We have MR days as well. So unless you're doing procedures, you are reporting whatever scan that's on your work list. You are answering pages from referrers or people who have queries about scans that's already been done. Yeah, just a lot of pages. Yeah, and then you review with your staff and ask them questions. Sometimes you have a resident, and depends on the level of the resident, you might fit into some teaching. Sometimes you have a medical student and then you can fit through some teaching as well. And if you're on procedure, then you kind of, I usually review my entire day's list first so I know what I'm dealing with. Have like if obviously like, you know, if someone's got multiple lesions, which one is best to target? Then I would consent the patient with the sonographer in the room, and I will kind of check everything, like we're targeting the right lesion, make sure the staff is around, make sure they're happy with what I'm doing, and then just kind of get through the day's procedure lists. Yeah, so we do anything from targeted liver and kidney biopsies, mesenteric nodes, to kind of more superficial axillary groin nodes, to thyroids, to carotids. So yeah, so lots of variety, really good. And you get to work with sonographers, which is really cool as well. Because otherwise being a radiologist, people do say like you do feel a bit isolated because you just kind of sit in your dark room and don't talk to anyone unless they're paging you. And yeah, so it's nice to be working with people as well.
And out of all of this, if you did have to pick, what would be your favorite part?
It really depends on the mood, you know. Some days we don't want to talk to people, and then it's good to just get through a CT list, you know, and do lots of reporting. Some days you might feel like, yeah, I can deal with talking to people, and then it can be really rewarding having patients and having patient contact. Yeah, so it's hard to say. Variety is really good, and the way Ottawa is doing it is really good, because I know a lot of the Abdo fellowships around Canada, you don't necessarily get to do ultrasound guided procedures. A lot of bigger hospitals, they're kind of all done by IR. So the fact that we get to do that here, and it's quite an important skill to have, I think, especially like if I decide to go back to New Zealand. Most of our hospitals in New Zealand are not subspecialized. Like you kind of have to be a generalist. So having those skills would really kind of enhance your work at home. Yeah, so I know if you're in Toronto or some other places, like if you're doing abdo imaging, you just do imaging and diagnostics and there's no hands-on. So it depends on what people like. You know, some people don't want to do any and other people don't mind. Yeah.
I see. Um, what general advice would you give to medical students and trainees?
I think I was talking to some residents recently. I think for medical students, even if you've set your mind on radiology, it's still really important to kind of be curious and pay attention in your other rotations, because I think any clinical exposure, any experience you have in clinical medicine will pay off later on when you do radiology. Yeah, just like even just knowing, what postoperative complications there might be. A lot of our knowledge and experience are from cumulative time when you're a medical student and through your working life. So I feel like any experience is good experience, even though like you might hate general medicine, but it's still going to be useful when you're a radiologist. And I think that's the difference between the Canadian system and what I've gone through, like, because I just had to spend so many other years not doing radiology. And a lot of it is that I didn't know what I wanted to do. But I think in the end, you'd kind of have more experience. And like when you are on your surgical run, I don't know how much you're allowed to do in Canada as a medical student or as a trainee, like try to get your hands in, go to OR, have that feeling of what's it like to cut skin, because a lot of people are surprised at how hard skin is to, penetrate with the scalpel. And just little things, like you might even not notice that it's any learning at the time, but later on you're like, oh yeah, this is just, yeah, it's not new things to you when you're a radiologist. In terms of for residents and trainees, like I think it's important to, I think you guys are really high level. Like I think coming from New Zealand, everyone at home is a lot more laid back than you guys are. So so at home, I would say, every day treat yourself as if you're a radiologist. Like even though you're learning, you should aim to function or write your report. Think about what you're writing. Think about what each word means. Like take your job as if you're already a radiologist. And I think that's quite important. And it's just like maybe work ethics or whatever, just, aim to function at the level of what you will be in a few years' time. Yeah.
See, that's
I don't know if it makes sense.
that's absolutely very thoughtful advice, and the message that I keep on getting from program directors and from practicing radiologists is that it's important to become a good general clinician at first before thinking about radiology.
Definitely. Yeah. And I think the fact that you guys don't get to experience much clinical medicine is difficult because I just don't know how you do it. Like, yeah. Anyways, but yeah, do embrace all the clinical exposure you have during your clinical years and in your intern years and all those years. Yeah, it's all gonna pay off later.
This next question might be jumping the gun a little bit, but I'm certainly curious if someone who is, for example, in my role, a second-year medical student and is interested in abdominal radiology in particular, is there any different or specific advice you could give to someone like me?
Yeah, I think get into research if you can. Like go to the radiology department or email them and see if there's a staff that's interested in academic research and jump on it. It's one good because you kind of get to know what's coming up in radiology, like whether it's about imaging techniques or, protocoling, or if it's about new ways of interpreting something, or new classifications of tumors. It's just good to open your eyes to that. I'm not very strong in research, but I think if you, yeah, like it's good to kind of have a feel of what's coming in radiology, in abdominal imaging. Yeah, which you'll either enjoy it and, you know, or you might not. Yeah, or you might just feel like this is not for me and maybe I'll try neuro or something else.
I see. And are there any big exciting areas of research in abdominal radiology that you would like to share about?
No, like I said, I'm terrible at research. I just don't have one of those critical minds like some people do. So we need to do a research project during our fellowship years. And I am doing one with one of the most amazing staff radiologists who has lots of research projects. So he's the supervisor and he's making sure I'm on track. So at the moment, I'm just kind of in data collection stage. It's about prostate and PIRADS and yeah. So yeah.
All right. Earlier in the interview, you mentioned that you are very visually oriented and you feel that that set you up very well to be a radiologist. What are some other good traits to have as a radiologist?
Um, so we all kind of have different levels of attention to detail. You kind of have to pay some attention to detail to be a good radiologist. And then that's a spectrum of like, you know, some radiologists are really particular about everything. But yeah, you need to be at a certain level of OCD to kind of do radiology. You probably really important to have good communication skills. Like I said, like most of our communication with clinicians via our report. So really important to understand the effect of words. Yeah, like I think that's, so one of the residents I'm working with recently, she's only second year, so, you know, and like several times it's kind of, I think at that stage, like, because in your second year, you're just into radiology, you're forming your words, and you come from a complete, like, non-radiologist lingual to having to learn all these things that we say. Not to say that all we say are correct or whatever, and people have different styles, but like, it just kind of reminds me of those early stages in radiology that you kind of really have to reread your report and see if it's really clear. Just little things, you know, sometimes you forget to say which side or which organ this lesion is, and just little things, you know. So communication, and also communication with interruptions. So communication with the techs if they ask you a question, or communication with the clinicians when they query your report or refer patients to you. Like at home, we have more of a discussion with clinicians, which is really nice. But here, like, it's mostly people ring you up and want a scan, and you kind of still need to communicate well. Yeah, so that's really important. And I think that's something that we don't think about, because most people think radiologists are kind of antisocial and awkward. But I think if you have good communication skills, it really goes a long way in your career.
Speaking of the stereotype of radiologists being antisocial and awkward, what are some common myths about radiologists that you would like to disprove today?
Yeah, I think the newer generation of radiologists are actually quite sociable and quite normal, you know. Maybe, yeah, ages ago, there'll be some really awkward older radiologists, but yeah, but I think modern day radiologists, they are super smart, you know, and yeah, they're just really good clinicians. Yeah, and I don't know, like at home you have kind of really interesting personality as well in radiology. Some of them have like outside interests, and like the ones who have a yacht, they obviously go sailing and actually quite a lot of people at home go sailing and go fishing, and yeah, so we all kind of have hobbies outside of work, because work is another good thing about radiology is you leave work at work. You know, like you don't really have this ongoing continuity of care of patients staying on wards that you have to worry about and get called back in. Like when you leave, you hopefully finish all the reporting, checked all your spelling mistakes, and you can just go. Yeah.
All right, and on to our last question for the day. And this is a kind of a speculation. Where do you think that radiology is going or heading in the next 10 years?
I think, I don't know about Canada, like in New Zealand, they have gone through the last 4 years, 3 years, 3 to 4 years, there's a lack of interest in radiology from trainees. And I think everybody is really apprehensive about AI taking over jobs. But I think I'm quite excited about the prospect of AI making our lives easier. So, you know, if there is a reliable and efficient AI that can just measure your pulmonary nodules, or, you know, pick up those little polyps in your CT colonography, and then we don't have to do all the tedious things, and we can triage our time and effort into more, you know, more cases and more patients that are actually clinically going to matter. Yeah, so the potential or the prospect maybe of AI helping us is really exciting, and maybe it will come in the next 10 years time. And also, yeah, I think that's the main thing. And the other thing is telerad, the potential of radiologists choosing their lifestyle, choosing where they work and how much they work, having a platform that they can have ongoing amount of work that, you know, like there's an ongoing list, work list that you can just grab and report and do what you enjoy doing, have the mental stimulation while having a lifestyle that you want to live. That's really exciting as well. And that's actually already happening, but yeah.
I must say it's been a real treat having this opportunity to interview you today.
Thank you
So much for your time.